Previously on a very special episode of Simple Lines Anatomy, we talked about how movement and pain are related, how movement can actually inhibit the sensation of pain. It can partially block it out. Not entirely, but partially block it out. And so this is the reason why, if you can do it safely and relatively gently, if you're in chronic pain, you can add exercise to your life and expect that over time, with improved movement and more movement as a whole, you can expect to experience less pain. And this is actually fantastic because it's beneficial on a number of different levels. Well, it turns out manual therapies, and those are manual therapies like chiropractic, like osteopathy, physiotherapy, physical therapy, fascial stretch therapy, Bowen, all these things actually work on the same principles. And what they can do is detect immobilities, immobilized areas, and they can reduce restrictions. And these might even be things that you are not aware of. In fact, that's the theme here. In fact, oftentimes you're totally unaware of the immobile areas in your body, and you're missing out on important feedbacks into that movement-pain relationship that can drastically help you over time, of course. So one of the simple concepts we like to encourage the understanding of is that strain and immobility are really mutually interrelated, but it tends to work more in one direction. So let's say we strain. We start with the strain of a tissue. Generally, it will eventually cause immobility. So let's say we take our spine here. Spine is just a great example of a big feedback mechanism because it's got a lot of joints. And we harshly go to one side. So we essentially opened up the spine. We're going to see a curve form here, which means it's being more pulled apart on this side. So we've got shortening of the tissue here and lengthening of the tissue on the right. So right and left side is short. That's generally how that works. And we're going hard. We're not causing a small amount of stretch. We're causing a large, almost violent amount of stretch. And so on this side, that tends to be pulled upon, so that's where we get strain from. And this could be as deep as the joint capsules. It could be these tiny little bits around here, these little capsules surrounding the facet joints, or even the intertransverse ligaments are a good example of that. Even some of the muscles in the area, for sure. There's no tissue that can't be strained if you push on it hard enough. And so how the body tends to react is it starts firing off those muscles that were either stretched, or as a result of stretching out the ligamentous tissues, it will create pain, but it will also create a contraction in the area to attempt to reduce the strain. It will pull to this side. And now if it just so happens to be that position doesn't change as a result of that, maybe the joints get stuck, or maybe we're loading it out constantly over time, what tends to happen is we add immobility. So this strain, even though initially it was pulling it apart, it will lock down the area and will add some immobility. What tends to happen after that is we actually don't stop moving the way we should. We don't react to this area right here, and I'll explain that in just a minute. What we do is we keep doing movements. We keep going, hey, I need to bend to the side. I'm going to keep bending to the side. And what ends up happening is we push ourselves more and more. Now, because this area, this chunk right here is locked out, it's not moving, we tend to get that mobility. We increase the mobility, usually above and usually just below it. And we've covered this previously in other videos, but this is generally what happens. We don't stop moving the way we want to, and we end up hyperextending through other areas. We end up moving excessively because we just force our way through it, unaware of the restriction in a lot of cases. And what that hyperextension eventually does is simply adds more strain to new areas. And so now these areas become in pain and strained, and they will start to lock down, and this starts to build a growing pattern where it just goes in circles and circles, gradually building. Now this does take time. It takes a lot of time, in fact. It's not an instantaneous thing, because I've almost implied that here. But ultimately what that will do, all of this process, will leave us with gradual building and a gradual wearing down of the tissue. So this strain and immobility eventually lead to degeneration of the tissue. All these three coming together leads to tissue degeneration. Every single one of these is a form of that pain. It's a form of usually chronic pain. And though it's not the only forms of pain, there's lots of different forms of pain that we could go to, but this is the mechanical, physical cause of a lot of pain in our body. And it tends to be the chronic pain or C fiber stimulation that we get this chronic pain leading to degeneration, leading to long-term full body pain. So you can see how this process essentially builds. So now the reason we're not aware of this, the reason why this can build without us knowing, is that sensation, and that is both general mechanical sensation and proprioception, that's our positional body sense, they actually require movement to function right. So once you've stopped moving in an area, once you've really locked out a certain region and it just goes dark on us, stops moving, we can't feel that. What we do feel usually is the painful region. What we feel is actually the strain right there, not the immobility, which is a bit of a weird thing. It is kind of strange that we're designed to do that, but that sensation of movement is what gives us the idea of what it's doing. And once we've really built in an area of immobility, we've lost that. So this is why we tend to build into our movements forceful extra strain. So we force extra strain to occur, adding to it over time. So we actually need to generate motion. So when we start generating motion, the whole point of this, we start really generating motion to generate inhibition, pain, and movement again, we can see a rebuilding process. Because you do have to understand that though this has happened, our health, our general level of health, can be increased. And if you just so happen to have a decent amount of diet and exercise, you can find that over time, so that level of health plus our diet and exercise does equal rebuilding, because everything in the human body, every single joint, every single muscular tissue, even the TFL, even that crazy thing, they're all repairing and rebuilding at all times. Cells are splitting and dividing. And so if you give it a chance to do it right, you may find that this rebuilding actually helps decrease some of the degeneration. So you can actually remove some of this degeneration by replacing with healthy cells. Not always all of it. And sometimes you may be stuck with a certain level of immobility for the rest of your life. But over time you can decrease that as much as possible, as much as is humanly possible. Another thing that's really important to understand is as we're going through reintroducing movement, whether that's through exercise, whether that's through manual manipulation, detecting immobility, reducing restrictions, is that it will often hurt the first time around. So new movement hurts, period. That's just the truth, and we do have to deal with that. Too forceful a movement, yes, that will hurt. But when something hasn't moved in a long time, if suddenly we go in there and we start reestablishing movement, we start moving things around, the new sensation of it is like fresh tissue. It's like it hasn't moved ever, and now it has to relearn everything. And often the first signals coming through are pain because it's confusing. But that new sensation does create new mechanical feedback over time. And maybe it is painful at first, but as we get an area moving again, especially I should say in the spinal cord, as all these tiny little joints, their nerves start firing off, and areas of, previous immobility, spots that weren't moving before, as they start to move again, each one of them, every single one of these points is a feedback of mechanical reception, and therefore some amount of pain inhibition. Going back to our original point, as we increase movement, as we add movement to an area, we increase the inhibition of pain. And I know that's a weird way of saying it, but as we increase movement, less pain gets through into the central nervous system, less pain gets through to our awareness, and so therefore we feel less pain. So the ability of a manual therapy, or even an exercise therapy, yoga tends to be very good at this, qigong, tai chi, lots of others though. Manual therapy, its ability to detect immobilities, reduce those restrictions, especially ones that you don't know about, the ones that you're not aware of. This is hugely valuable because over time, as we increase the feedback, even though it can be painful, sore initially, it gradually adds to sensation feedback. And as we start to inhibit pain over time, long term, we feel better about doing more exercise. And I don't want to make this sound too much like 1980s boardroom, but as we build this is a synergistic. We build synergy into the system. And this is really important because it's a mutually effective process. Everything building on top of itself, ultimately leading to a healthier person for lots of different reasons. This has been Eldridge from Simple Lines Anatomy. As always, I hope that made some sense.